We have a lot of telehealth offerings here at Akron Children these days. Our Quick Care Online service offers quick visits with our primary care physicians to keep patients and families on the move and handling those common minor concerns that they may have. We also have scheduled visits through our MyChart telehealth portal that allows patients to connect with their specialist who they may have had to see in person before, but now can connect via telehealth. We connect in our ED for our TelePerk program, connecting those patients who may have behavioral health needs with those who are able to provide services acutely through our ED program. We also have our school-based health program, again, utilizing the services that already exist through Akron Children's to deliver the care that the patients need right where they are.
So a virtual visit is exactly what it sounds like, right? So I click on the screen and you click on the screen. I am joining you either from my home office or my office at Akron Children's Hospital, and you are joining me maybe from your home or your school. It's a virtual visit because it's multifaceted, right? So we're talking on the screen, but at the same time, I might be sharing my screen to show you a neat strategy or to show you a YouTube video or a PowerPoint. So it really is not very dissimilar than if you were sitting across from me in a treatment room. So I'm bringing some of those same tools. I'm using my brain glove. We're using the whiteboard option that's part of telehealth, again, to make this a really dynamic experience that makes it feel like you're sitting right in front of me at Akron Children's.
One aspect of telehealth that's been really incredible is being able to use it in the schools. As a school-based health nurse practitioner, I can't be in all 5 schools in my district at one time. However, with the use of telehealth services, any child can have access to me every day of the week that I'm there through telehealth.
So Quick Care Online is a way to reach providers fast. So this could be a service that you could use if you have a quick question that doesn't require a significant in-person interaction. I like the efficiency of it. So I'm able to meet with patients quite quickly to review a referral concern, to talk about their diagnosis, to talk about school recommendations that I make. So again, a really nice way to access providers via the telehealth platform.
A question that I often get is, when should I have a telehealth visit? Well, that answer can be pretty much any time. For patients that see their specialists, it's a great idea to ask them, is my next visit something that could be a telehealth visit? If it's something where there's a lot of conversation that needs to happen, and maybe they don't need to check any labs or check your blood pressure or height and weight, that might be a great visit for a telehealth visit. Also, if you have a sore throat, runny nose, itchy eyes, that might be great for a Quick Care Online visit. You can log on and chat with our primary care pediatrician who can help to identify if that's something they can quickly handle or if it's something you need to follow up with your primary care doctor about the next day. Also, if your child's in school, the school may reach out and say, hey, we need to do a telehealth visit with your child, which is again a great option to keep your child in school but also get the care they need from Akron Children's.
So we know that chronic absenteeism can affect a child's ability to read by 3rd grade. So we want to keep those children in school. Telehealth services through Akron Children's School-Based Health Center is a great way to keep children in school, which is going to improve outcomes long-term and help these kids succeed, which is what we're here for, to improve their academic performance and help them stay healthy and in school.
This generation of kids lives on screens. So while parents might be a little bit reticent and maybe think that this is different than in-person therapy, this is the way kids are learning. This is the way that they're socially interacting. And so as providers, we need to provide this service because this is the way that patients live. Patients live virtually. I've seen patients that I've seen both in person and virtually, and sometimes they're actually more open with me and more transparent when they're on the screen because for them the screen feels safe, especially when we're talking about challenging issues. So to be again in their safe space at home, being able to talk to me about traumatic events or things that are hard, we actually get more therapeutic bang for our buck by having patients really talk to me in their space of safety.
There are some really great things about Quick Care Online. I think the fact that it's quick, meaning that it's readily accessible pretty much any time of the day and into the evening hours when most families are just trying to figure out what to do at the beginning of the day or trying to wind down their day and figuring out what they need to do with their sick child. It also provides a service that's available anywhere. Again, you don't have to figure out what phone number to call or how to reach your office. You just get online and connect with a provider. And since it's provided by our Akron Children's primary care providers, you can know that you're getting excellent quality care delivered by people that are truly pediatric focused.